There are a few main components of the skeletal system. First, the bones that make up the skeletal system. Second, cartilages that connect bones to other bones. Ligaments that hold these cartilages and bones together. And then connective tissues that go in between the bones and sort of wrap everything up. There are a few different classifications of bones based off of their shape. First, there are sutural bones that form between the sutures of the skull. Then you have flat bones, like the ones that make up the skull itself. There are irregular bones, such as the bones of the vertebra. There are pneumatized bones that have holes or pockets of air within them. There are long bones, like the humerus and the femur. There are short bones, like the carpal bones. And there are sesamoid bones, like the patella, and some bones that form in the foot. Starting in the axial skeleton, we have the frontal bone, the parietal bone, temporal bones, occipital bones, and then within the skull, there is the sphenoid and the ethmoid. Moving down, we have the vertebra. There are 7 cervical vertebrae, and it starts with the atlas, followed by the axis. After the 7 cervical vertebrae, we move into the thoracic vertebrae, of which there are 12. After those 12, we have 5 lumbar vertebrae, followed by the sacrum and then the coccyx. Moving back up the skeleton, we have the ribs. There are 12 ribs in total. The first 7 sets of ribs are called true ribs, and the next set are called false ribs, and this is because they don't connect directly to the sternum. The last 2 ribs are known as floating ribs because they aren't connected to any cartilages. As I've previously stated, we also have the sternum. Moving into the appendicular skeleton, we have the pelvic, or the pectoral girdle, which is made up of the clavicle and the scapula. Connected to this girdle is the humerus, followed by the ulna and the radius. After the ulna and the radius, we have the carpal bones, which include the pisiform, the triquetrum, the lunate, the scaphoid, the trapezium, the trapezoid, the capitate, and the hamate. After the carpal bones, we have the metacarpals, which are labeled 1, 2, 3, 4, 5. And then after the metacarpals, we have the phalanges. Every finger except for the thumb has 3 phalanges. The thumb only has 2. Moving on, we go down to the hip bones, which are made up of the ilium, the ischium, and the pubis. Connected to these hip bones is the femur. Moving on from the femur, we have the patella, the tibia, the fibula, and then after that we move into the tarsal bones of the foot. These tarsal bones include the talus, the calcaneus, the navicular, and then the cuboid. And then we also have the cuneiform bones, which have a medial, an intermediate, and a lateral. Moving on from the tarsal bones, we have the metatarsals, which, much like the metacarpals, are labeled 1, 2, 3, 4, 5. After the metatarsals, we move into the phalanges of the feet. And just like the hands, they all have 3 except for the big toe, which only has 2. One important clinical aspect of skeletal anatomy, it has to do with the humerus. The humerus has a section called the surgical neck, which is where it's often broken. This area is in the metaphyses, which is in between the epiphyses and the diaphyses.